Hey everyone, welcome back to Relationship Entertainment TV. I'm your host, Felicia Dortch, with the news you can use and the ish you don't want to miss. So happy October, everyone. We're 2 weeks in, and I tell you, every day the closer I think about the next thing is Thanksgiving and then Christmas, moving way too fast. But I'm pretty sure everybody's like, yeah, can we hurry up and get 2020 over with? Hey, you know what? Let's live it day by day, because we don't know what 2021 is going to bring. Hopefully blessings and hopefully no corona, but we'll see what's happening. Well, keeping with October being Breast Cancer Awareness Week, I talked about this the previous show last week, but I wanted to bring it up again today, but focus more on African American females, and wanted to give some information that I hope is very useful for you today. And I'm really excited about this conversation because it gives a lot of things that you may not know. And it's keeping in with what's going on and what's on the news right now. So taking action to lower your breast and ovarian cancer risk. Some of us may not have known that African American women under the age of 35 have breast cancer rates that are 2 times higher than white women, of the same age. So that's a very big deal. We have to make sure that we're getting our regular checkups, like I talked about last week. I even talked about my experience with the mammogram, and I would imagine that one of the reasons for us having a higher risk is because a lot of times we don't keep up with our checkups. We don't go to the doctor when we're supposed to. And also, let's add in another one. Some people don't have health insurance, but through the clinic, through your neighborhood clinic or your neighborhood medical clinic, you can get these type of screens for free. So even if you have the Medicaid or the what they call the Obamacare, or the state or government issued insurance, you should be able to get your mammogram screening. Okay, so you want to ask relatives about their cancer histories. And this could be difficult for them to express to you, but you want to try to find out is if this is a familial link. You want to make sure that you're not missing the mark, and you found out that your grandmother had cancer and her mother had breast cancer and then your mother had breast cancer. This definitely should push you to go be screened and to make sure that you're okay. You want to about 5 things that you want to share is, share that you have learned that cancer run in the family. You can explain that you're creating a record of your family's history of cancer. So you can this may help open up the conversation about cancer history in the family. You can encourage family members to respond in a way that's most comfortable for them. One of the ways that I was able to find out about the cancer history in my family, I just straight up asked. And with me being a nurse, it was kind of easy for my mother to discuss with me, because she felt like I was just wanting to know because of my nursing background. But I wanted to know because I wanted to make sure that I would be okay. So, in all of my videos, I try to use something personal and be transparent with you. I'll give you an example of something that I have to do every single year because of what my mother went through, because of what her father went through. So my grandfather died from a brain aneurysm. Well, my mother had a brain aneurysm 13 years ago. So now, ever since then, I have to go to the doctor every year to get screened, and they pay attention to my type of headaches. If I say it's, you can tell the difference between a regular headache, a migraine, or something worse than that. My brothers are supposed to do the same thing as well, but I know for a fact that I have an MRI, I believe it's every other year, of my brain, and I pay a lot of attention to my headaches and what type of headaches I have. So that's just explaining to you the type of familial things that you need to continue to check. That's the same with breast cancer. If my grandmother would have had breast cancer and my mother would have had it, then I definitely would be going more frequently to get my checkups. As I explained to you in the last video, I put mine off, but I put it off because I do know the history of my family from what I'm being told. Okay, again, you can word your questions carefully, be a good listener, don't push the issue. But if you have some concerns, let them know you have the concerns, and that may help them explain a little bit more. And then also, if, for example, if my mother wasn't sure about it, I would probably go ask my aunt more about my grandmother's history, or anyone that I think would know my grandmother's history. Y'all, please excuse my dog. She is determined to get in here and get on my video, I suppose. Okay, and then let's say you find out that you may have the familial link, or someone in your family, your mother or grandmother, great grandmother, did have breast cancer, or maybe a benign tumor, which meaning is non-cancerous. Then you want to definitely understand the counseling and testing. You could go and get genetic counseling if you can't get the information from your family members. Now, genetic counseling can help you understand your risk based on personal and family medical history. So in the genetic counseling, what they would discuss is the genetic test right for you, specific tests that they might use and their accuracy, possible genetic test results, and next steps that you may take if they find out that you are a carrier of the gene, meaning that you're more prevalent of getting breast cancer. They'll teach you how to trust the results, and the results may not give you all the information you need, but it'll steer you in the right direction and to the right person you may need to talk to. The emotional and the risk benefits of genetic testing. Now, that could be really scary to do. I've never had to do genetic testing for cancer, but getting an MRI every year, and you're stressed out and you're worried about it because you do understand you don't get those results right away. So can you imagine the emotional side of it, as you've watched your grandfather pass from an aneurysm, your mother had to have brain surgery from an aneurysm, and then you get an MRI every year and you have to wait. You wait for those results, for them to either tell you, yes, we see something, or no, you're good, see you next year. So it's a lot of emotions that go into that, okay? Now, the genetic testing helps you learn your family history of breast cancer. Again, like I said, due to family history or medical history that you may let the doctor know that you have some concerns with when you go for your mammogram. When you do go for your mammogram, they will ask you, is there anyone in your family that may have had breast cancer, or, your grandparents, paternal grandparents, maternal grandparents, meaning your mother and father's parents that may have had breast cancer. That's going to help guide them on what they want to do next with you. Okay. So a positive test result does not mean you will definitely get breast cancer or ovarian cancer. If you test negative for a specific gene mutation, you may still be at an increased risk for breast or ovarian cancer. So I know you're saying, well, then what's the point of getting tested? Well, you get tested so it can start the conversation. Even if you say, let's say your test come out positive and they say, yeah, you're more prevalent on getting it. It doesn't necessarily mean it's going to happen, but they can start taking the precautions or start determining what they need to do to reduce your risk factors. Okay. So some of the things that you can do to reduce your risk factors is maintaining a healthy weight, get enough physical activity. And when you breastfeed your babies, did you know that decreases your risk? And of course you're saying, well, I can't breastfeed them until they're 12, but you can exercise every day. You can eat healthy foods every day, green leafy vegetables. You can find, even on Pinterest, will help you with things that are healthy for you that are simple. Really simple recipes. You don't have to go and spend tons of money to eat healthy. You have to kind of be creative and smart and try your best to, incorporate lots of fruits and vegetables, which I know some of us don't really like, but I actually enjoy it. I'm not against meat, but I don't eat a lot of meat. Sometimes I guess when I feel like I want to eat meat. But the thing is to educate yourself and do what you can with what you have. Not everyone can run to the gym and go exercise. But for an example, I went this morning before everyone woke up and I walked for 30 minutes. I put ankle weights on my ankles and I went walking. So you have to do everything you can to reduce your risk factors, as well as put yourself in a better, healthier state. So if you do feel something abnormal, you tend to recognize it more if there's not a lot of fatty tissue around, and I know a lot of us don't want to do it, but I have to literally push myself to continue to go out and work out and at least walk, even if I don't get a chance to go to the gym. Okay, so knowing your cancer risk and being proactive about health may help you take steps to lower your risk, as I was saying, like making sure that you're getting your breast or ovarian, your pap smear. You want to make sure you do that every year. I know it's not the best, it's not the most fun day that you could have, having some machine squeeze your breast and having a pap smear, but it's something that you need to do to take care of you. Okay. And again, as I said, African American under the age of 35 have a higher breast cancer rate and 2 times higher than white women of the same age. So we definitely have to take care of ourselves, okay? And maintaining a healthy lifestyle, especially now with COVID, we're kind of stuck in the house. And even if your city has opened up more, you tend to shy away from big gatherings, but find out what your local community center's doing. Some of the community centers here in Houston do free aerobics. They do free workout sessions. Or if you just go, like I say, take a walk. If your mailbox is not right in front of your house, instead of driving to it, walk to it. Make a point to get out and maybe ride a bike. I know bikes are scarce. I literally just bought myself a bike probably about 3 months ago, and it was extremely difficult to find. So you want to try to find anything that's going to help you get active. Get some walking buddies, get maybe some ladies that's trying to lose a little bit of weight and you want to lose a bit of weight. Y'all get together and meet in the mornings. I have some friends that we meet in the morning, we go walk around the lake, or we meet in the afternoons, or we meet in the evenings. I work from home, so I take my lunch break and I take my grandbaby out and we walk. I put her in a stroller and I walk, put my music on and walk. So just do everything that you can to try to reduce your risk factors. And remember that we're at 2 times higher risk, and us meaning African American women. Okay, making sure you get your checks, make sure that you talk to your family, make sure that you talk to your daughters, and also don't forget about our males. As I told you last week, men can get breast cancer. So let's pay attention to your bodies. Do your checks, your self checks in the shower, or when you're just about to put your shirt on. Just be proactive. It's difficult to watch patients come into the hospital and we're trying to save them with minimal time because the cancer has been there so long. I'm not saying that it can't be done, but it's a lot easier when we're catching it when it's this big, or when it's just something just not right. Just give the doctors the opportunity to really have the time to go through everything that's great for you, that'll be the best outcome for you as a patient. It just makes it difficult when we're at the last stages. And, not saying it can't happen. It just makes it real difficult. So again, keeping with October, the Breast Awareness Month, wear your pink, reach out to the ladies that are surviving this. I have a classmate and I was so excited. It brought me to tears. I saw on Facebook, she got to ring the bell. So she's been in remission for a year, and that is a blessing. So please keep up with your checks. Until we meet again on Thursday, this is Felicia Dortch with the Relationship Entertainment TV, the news you can use and the issue you don't want to miss. Bye.